Hello. Okay, hi, it's Kathy Frey here, and welcome to another maternity natural health webinar hosted by IMCO, the International Integrated Maternity Healthcare Organisation. And we've got the fabulous Dr. Julia Bartrop here today. Hello, say hello, Julia.
Hi, how are we all?
And we're just seeing that people are starting to sign on in, so that's absolutely wonderful. And Julia has been a guest with us before, and I was very excited to get her back because, boy, she delivers a lot of information in a short period of time. So really, really practical, useful, fascinating, interesting presentations. So no pressure, Julia. Poor thing. It's not very nice. And so, look, the topic today is going to be about postnatal care and Chinese medicine in relationship to that. But just a little bit of background about Julia. So Julia is a mum of 2 girls, and she's been practicing Chinese medicine for 7 years now, and she integrates both the Western and Eastern medicine to achieve that holistic treatment for all her clients. And of course, you know, that's the epitome of integrative medicine. So fantastic. And but Julia's got a particular passion for women's health and fertility and pregnancy and postnatal care. So all around that maternity journey. And of course, she's a doctor in Chinese medicine, and which means she uses acupuncture and Chinese herbal medicine, and also lifestyle information to assist her clients. So we're going to be she's going to be talking today about the golden month, and that's that sort of nurturing time for the mother. And you know, when I, as a midwife, what we call a caseloading midwife, so you know, when you are taking women on through their pregnancy and birth and postnatal journey, if around 50% of my clients were Asian and Indian, so I dealt with a lot of Chinese, and yeah, it's a fascinating. Some of, you know, the things that they do culturally within that postnatal time can initially, if you're not used to it, seem kind of strange and restricting, and you know, once you get to know it, you realize it's so healing. So and often I would just feel for my European mums in the postnatal period and think, oh, what they need is a Chinese mother.
Yeah, exactly.
Yeah, so look, those that are here with us live today, because I know a lot of you watch the webinars afterwards, but those that are live, we'd love to know whereabouts you are in the world and what your role is. So do click on in and to the chat area, which is down the bottom, and let us know there. That would be wonderful. And we have got somebody. Kalali, I see that you have put some questions in there, but they are not in English. I'm guessing they're in French, but I don't speak French, so if you could type your questions in English, that would just be wonderful. So yeah, welcome everybody, and welcome Julia.
Thank
I'm
you.
going to hand over to her, and Julie's going to take over the presentation, put up a PowerPoint, etc. Do put your questions in that you have in the Q&A at the bottom, and we'll absolutely make sure that we get through your questions before we finish the presentation today. So welcome, Julia, and you can take on over the screen.
Thank you. Can you see my screen? Let's just see if it's there.
Yep, we can see it beautifully.
Yep, perfect.
Yep, all good.
Okay. So hi everyone, I'm Dr. Julia Bartrop, and today I'm going to be presenting on postnatal care and traditional Chinese medicine. So I'm going to give you an overview of the golden month and then how we really assist women to recover from 9 months of pregnancy and also giving birth. So let's get started. I do have quite a bit to get through, but I'm really excited to share all this knowledge with you. Okay, so traditional Chinese medicine and the golden month. So it's not just in China. There's a long history in China and across many different cultures, such as Malaysia, India, Taiwan, the North Americans, and the American Indians as well, to actually preserve the mum postnatally. So in Chinese medicine, this is referred to as 足月血, which is sitting out the month. So it's generally about 30 days, and 足月血 actually refers to one lunar cycle. So when we're pregnant, we're actually full of really yang energy, where we're quite warm, we tend to run hot. However, when we actually give birth, we lose a lot of body fluids and a lot of blood, which means that we tend to be more yin in nature. And women themselves are yin in nature, and we actually, our cycles mimic the moon. So our cycles actually go with the moon. So 足月血 actually reflects sitting out one lunar cycle. So what happens is that generally it involves the mother or the mother-in-law coming to stay for that 30 days, or in some cultures it's actually the 12 weeks, which is the full 4th trimester. And basically we need to make sure that mum gets plenty of rest, that she stays warm, and that she has a really nourishing diet. So by doing this and actually preserving the mum postnatally, so making sure that for 30 days there's no visitors, she is looked after, she is nurtured, she is nourished, you can actually improve her overall health for the next 20 to 30 years before she goes into menopause. So there's actually 3 times in a woman's life that we can actually really enhance their health and vitality. And that is at the start of menarche, postnatally, and then at the start of menopause as well. So traditionally the golden month is about 30 days. So we say 30 days of physical rest. You can do light exercise. So when we're talking about light exercise, we're talking about stretching. We're talking about just some gentle yoga, some qigong, some gentle walking as well. And then really focusing on that nourishing diet. So typically it's 30 to 40 days after giving birth, or actually recovering from a miscarriage, or after having an abortion as well. And the focus is on recovery. So the focus is not on having visitors. It's not on, oh, look at my baby. It's very much confining them to the house, which I know it sounds really terrible, but it's actually blocking out all outside world just so that you can focus on mum's recovery. So the whole golden month actually forms a system, and that includes diet and lifestyle practices for the first 4 to 6 weeks after giving birth, or post miscarriage or abortion as well. So it is really strict. So basically in ancient Chinese culture, after giving birth, you're not meant to shower, you're not meant to wash your hair. The idea is that mum or mother-in-law moves in and takes care of you. So they do some alcohol washing just to get rid of the oil, etc. But the reason why we're not meant to shower, we're not meant to wash our hair, is because after giving birth, we're actually weakened. So we've lost fluid, we've lost blood, and we've also lost a lot of energy. So if people, when we tend to run cold, we need to be kept warm, and our immune system, or the Wei Qi, which is that protective layer in our skin, is actually weakened after giving birth as well. And so if you shower, or if you have wet hair, from traditional Chinese medicine, the idea is that that cold can actually get into the body and can affect your recovery. So that's why they said no showering and no washing of hair. So they do wash, so you just get a flannel and wash like they did in the old days, so that they're kept clean. But that's one of the reasons why they say do not shower, do not wash your hair. So the 3 components of the golden month is rest, diet, and lifestyle habits. So focus on nourishing mum, on nurturing mum, making sure that mum is getting plenty of rest, and that she's nourished emotionally as well as physically. So for women who've had a miscarriage, an abortion, or a C-section, or are actually over 35 years of age, it is recommended that we actually have 6+ weeks for recovery, just because there's more trauma, there's more physical trauma to the body, and it can take longer emotionally and physically for the mum to recover. So, as mentioned, postpartum recovery enhances a woman's health, and during this time we are focusing on addressing emotions, helping them to recover physically, so build up their energy, build up their blood, support lactation. We also balance hormones, and we help to heal them from any previous weaknesses in their organs that they may have had prior to pregnancy. So this is the benefits of Chinese medicine, is that we can actually enhance their health and improve them to what they were prior to even getting pregnant as well. So it's a really, really important time to focus on her recovery and enhancing her vitality. So as mentioned, it's rest, it's correct diet, so making sure that she's eating warm food, really nourishing food, and food that's easy to digest, and doing gentle exercise. So your gentle exercise is just walking, again, stretching, hands, and doing circles with your hips, laying down, just stretching out the body, and also qigong and just gentle yoga. So like 5 minutes of yoga, you're not going to be pushing yourself. It's just to get your body moving after having birth. So physical treatments, so that is in home, and generally it'll be the mother-in-law or the husband massaging the hands while she's breastfeeding, or doing a foot massage, or massaging through the neck and shoulders, because we all know that when we're breastfeeding, we tend to do this and get really tight. And this is actually nurturing the mum, so giving her nourishment and nurturing her and helping with her recovery, and just letting her know that she's loved. And this all helps to enhance her recovery. So in the Western world, the Western society has actually forgotten that mums need this time to recover. The Western world's very much on, okay, you've had a birth, you know, just get on with it, just recover. You know, everything's fine, stop whinging, you've got a baby, be happy. However, this is not how women postnatally are meant to be treated. And basically, they're not getting the support, they're not getting that rest, and they're not getting proper nutrition, which is so important in a mum's recovery. Western society is very much push through, keep going, don't whinge, and which is why that we're actually having so much more postnatal depression. So here in Australia, 1 in 6 women actually have postnatal depression, which is absolutely, you know, astounding. So by pushing women to keep going, it actually creates really a lot of stress in their body, especially when they're new mums and they should be focusing on just bonding with baby. It causes them to become depleted, both emotionally and physically. So it causes problems with their energy flow, with recovering their blood volume, and also with breastfeeding. So we want to really iterate that support and care is vital to a woman recovering postnatally. If she has that support, if she has that nurturing going on, she is nurtured herself, she is able to nurture that baby, she is able to recover, and she has a much better recovery than someone who doesn't actually receive that. So from a traditional Chinese medicine, postpartum support is holistic. So they may be coming in with symptoms of low milk supply, stress, anxiety, just physically fatigued or exhausted. However, we're not just looking at the symptoms, we're treating the whole person. So we want to have a look at what's going on physically. We want to have a look at what's going on emotionally, and also on a mental well-being, so that we enhance their general well-being overall. So we're incorporating acupuncture, Chinese medicine, diet, lifestyle issues, breathing techniques, and exercise as well within our form of methodology to actually assist women. So during the golden months, the focus is on establishing breastfeeding, mum bonding with her baby, and mum resting. So she's not expected to do anything else. So when the mother or the mother-in-law moves in, basically she's there to do the cooking, she's there to do the cleaning, she's there to keep the house, she's there to look after mum. So mum shouldn't be doing any cooking, any cleaning, any heavy lifting. All she should be doing is bonding with her baby, resting and sleeping and recovering from that 9 months of pregnancy, because when we're pregnant, we're actually growing a baby. We grow a placenta, and we're using a lot of energy, and the baby takes up a lot of our energy, a lot of our nutrients, and then we give birth. So we lose more fluid, and we lose more blood, and we lose more energy. So technically it actually takes us not just the 30 days of the golden month when we actually withdraw from the world and give ourselves a chance to rest and have space and recover. We're getting to know our new babies, but we're also starting to try and find a sense of ourself as well with not being pregnant. So with the golden month, it is really, really strict in China. So they say no visitors for 30 days, 30 to 40 days. And again, it's generally that you are confined to the house, although more modern China, they're doing different ways now. They're actually going out to the country houses or to hotels, so that it's not that they're trapped in the city, and they can actually go outside for physical exercise and walking. So in the golden month, food is prepared for mum, and this is actually a form of nurturing, and nourishing mum as well. So from a Western world support, how can we actually incorporate the golden month into the Western world? So when mums are coming to see me and they're pregnant, we actually talk about this from 36 weeks or from earlier in the pregnancy. So we can organise a postnatal doula. So if you're internationally or interstate from family and you can't get family and friends to come and help, we can hire a postnatal doula. So she will actually come to the house, she will do the cooking, she will do the cleaning, she will look after the house, and she will actually make sure that she's cooking food that is really going to nourish mum and nurture her and help her with her recovery as well. So the postnatal doula can take Bub, so mum can go and do 10 minutes of gentle walking, or have a shower, or just sit down and have a cup of tea and a drink of water as well. She can do the massaging around the shoulder, of the hands, of the feet, and she's there to take care of mum, so that mum doesn't have that pressure of cooking and cleaning, which can create more stress. So also cooking meals prior to giving birth, making sure that the freezer's stocked and stocked with really nourishing food. So making sure that there's bone broth soup, that there's casseroles, and really nourishing, warming food, and so lasagnas or quiches. And that the fridge is stacked and the freezer's stacked. Also having friends and family come over, but making sure that when they are coming over, you're limiting it to one visitor a day. You actually tell them, okay, we can have a person coming over, you can come over for an hour, and just making sure that they bring something to eat with them, so that they're replenishing you and nurturing you. So I always tell, I've got a blog, and I always tell friends of new mamas that you need to give them space, and you need to give them their chance to rest and bond with baby. And it's not about you, it's about them and their family and their recovery. So don't get upset if the new mum says we're not ready for visitors. So people need to get it into their head that it's not about them coming to visit the baby. It's not about them seeing the baby. It's about the mum and her bond with the baby and her chance to have rest and space and rediscover herself, and to have a chance to actually recover and just withdraw from society until they're ready. So again, with women who have had a C-section or women who are over 35 years of age, it's recommended that it's 6+ weeks of recovery, basically because you are cutting through all those muscles. So there's more trauma. You do need longer to recover, because compared to a vaginal birth, with having all of those muscles cut. So there can be some emotional as well as physical trauma going on, which may need to be healed with C-section women as well. So for my clients, to try and bring the modern day golden month, I recommend not having visitors for the first 2 to 3 weeks. I just tell them they need their space, and to let people know that they won't be having visitors for this time, so that other people don't get caught off guard, and that they will let them know when they are ready for visitors. This is so that they can focus on bonding with baby. They can focus on having space to adjust, to let their hormones balance. So we don't want people coming in on the day that, you know, your hormones take a dip and you're having the 3-day blues, because that can actually make things much worse. And that she gets enough rest as well, and that the family has a chance to bond and get used to the new dynamics. So, and this means that if there's an older sibling, mum still gets a chance to spend time with that older sibling and let that older sibling know that she's still there, that even though there's a new baby, they're still loved as well. So how do we help to assist mums with their postnatal recovery? So I see women through fertility, through pregnancy, and before they go to give birth, I will actually hand them out some moxa sticks. And we start mother warming from 3 to 5 days postnatally. And then they continue to do the mother warming for 2 weeks postnatally. So we do have an acupuncture appointment within the first 2 weeks. I would generally go and do a home visit, although some women prefer to come to the clinic because it just gives them a chance to get out of the house and just have that safe environment where they haven't got any other distractions as well. We focus on diet, so making sure that they're having warming foods, nourishing foods, that the foods are warm in temperature, which helps to warm mum's body, that they're drinking lots of water so that we can get rid of all of that excess fluid and blood volume after giving birth, and that they're getting plenty of rest. So when we mean rest, we say sleep when the baby sleeps. Some women can't necessarily do that. So when we're talking about rest, we want them to be sitting down. We want them to sit down and eat. We want them to sit down and have a cup of warm tea. We want them to sit down and have a glass of water. We want them to sit down and just stop, not be on their phone, not be worried about something, just sit down and eat and drink and have a chance to just calm down and rest. So again, how can we help with this if there's no family assistance? So getting in the postnatal doula, organising nannies, especially for multiple births, hiring a housekeeper, although with COVID it hasn't been that easy, and then asking friends and family for support during this time, and also for the 12 weeks after giving birth. So we also focus on abdominal binding. So in the ancient days, it used to be like a sheet, and then they used to come and wrap you up every day. In Western society, this is not so easy. So we do use the SRC support shorts, and they actually come up to just under the boobs. And that helps to bring all the organs back together and help to create shape, and also support that stomach and that back as well, while everything's coming back into place. And these can be worn as long as the mum needs to, and it also helps with that abdominal separation and bringing the abdominals back together. So diet, so we want to be focusing on nourishing, warming foods, so foods which are high in protein, and this is where our congees come in. So congees are really easy to digest, and congee can be made out of rice, can be made out of oats, or can be made out of quinoa. So also incorporating porridge, so which is your oats and quinoa porridge. So the congees in the porridge actually help to clear heat within the mum. They help to calm the mind, and they help to nourish the blood, and also help with milk production as well. So in Chinese medicine, blood is the main force behind milk production. So if she's low in blood, she's had a hemorrhage, that can affect milk supply as well, which is why congees and porridges are actually really, really good and nourishing for the mum. They provide a lot of nutrients and a lot of energy for mum. And we want mum to be having foods that are really easy to digest, that are easy on the digestion, so that there's excess energy left over for her to recover, to produce blood, and also to produce breast milk as well. So with the congees, you can have a basic congee recipe, and I've included this in your handout, and you can make congee sweet, you can make it savory, you can add extra bits to it. So I get the mums or whoever's looking after mum to put it in a slow cooker overnight, and then you cook it for 8 hours. So you want to add in some herbs. So ginger is really good because it's really pungent, it's really warming, it helps with the digestive enzymes as well. And then you can add in like a boiled egg. So a boiled egg is going to give her lots of fat, lots of protein, carbohydrate, zinc, selenium, vitamin E, and this is going to help with digestion, help with energy, help with milk production. You can add in mushrooms, which are high in B vitamins, which is going to help with energy. Again, you can put some garlic in, some chicken. So there's heaps of things that you can do with congee. You can add in sweet potato as well, which all help the spleen and stomach organs and work with digestion to give mum that energy and that nourishment to help her recover. So bone broth soups, so these are really, really important. So especially essence of chicken. So you want to boil those soups for about 6 to 8 hours, take out the bones, and then you can have that as the stock. So I always say freeze some of that stock, and then you can add in root vegetables. So your carrots, your sweet potato, your Swedes. And then the other thing that you can do is actually roast veggies. So roasted beetroot is actually really, really good. It's easy on the digestion, but it's a really good good blood building vegetable and helps to nourish blood, build blood. So it's really good for recovery as well. So red date tea, so you can go into Asian shops and just get the red dates. They're also known as dazao. So they're dried. You want to boil those for about 2 minutes, and then you're going to drink the liquid. So this actually helps to nourish blood. It reinforces the digestion, so working on the spleen and stomach meridian, and just helping to pass all that extra fluid that we need to after giving birth. You want to make sure that they're having warm foods. So you want to focus on your soups, on your congees, casseroles, stir fries. You don't want foods to be straight out of the fridge because that can affect digestion, and it actually uses more energy to digest the food than what mum will actually get from it. So that can cause her to be depleted. We don't want her drinking freezing cold water straight out of the fridge either, warm water or room temperature water, and try and avoid raw food because, again, that puts a lot of strain on the digestion. If people want more raw food, we do suggest that they blanch the food, so just add some heat to it, which makes it more easier to digest. So literally just cut up carrot sticks or some celery, and then just heat it in the fry pan for 1 to 2 minutes, so that you've still got the nutrients there, but it's much easier to digest. So postnatal treatments, so as we said, they're holistic and they're individually built, individually based on the woman that I have in front of me, and it's dependent on how their pregnancy was, how their birth went. And we focus on restoring the vitality, but also addressing emotions. So a lot of new mums have a fear, am I doing this right? Why is this not working? What am I doing wrong? So there can be a lot of stress and a lot of anxiety going on. So we're there to calm them down, to reinforce that they're doing an awesome job, that everything that they're doing is correct, and just to reinforce their mothering instincts and let them know you're the mum, you know what's going on, everything you're doing is fine. So we start treatment from 2 weeks if we see them physically, but however, I will teach them acupressure routines that they can start doing on themselves as soon as they've given birth. So this point here in the picture is stomach 36. So it's actually 4 fingers down from the eye of the knee. And this is a fantastic point to actually help with recovery. So it works on improving digestion. It enhances the energy of the spleen and stomach, which are our digestive organs. It builds up blood. It builds up energy. It improves our immune system. It's used to calm the nervous system down. So you can hear just from all of that, this is an amazing point. We also focus on mother warming, the diet and homework. So I'll give them breathing techniques, different lifestyle advice as well prior to giving birth. And then we focus on herbal formulas and teas. So depending on how they've gone through their pregnancy, I will give them herbal formulas that will last them for a month. Or if they don't want to take those formulas, I'll make up hand blended teas for them. So again, we're focusing on reinforcing energy, on building up blood, keeping the nervous system calm. And we also look at balancing emotions and balancing hormones as well. So, and as mentioned, stomach 36 is an important point to do self-acupressure daily. So I'll get my clients to press this point 3 times a day. So because it is such an important point, and you're going to hear me talk about this a few times. So mother warming. So mother warming is performed 3 to 5 days postnatally. It's used with a moxa stick. So you can see that in the picture just there. It's Ayer in Pinyin or mugwort or Artemisia. So the property is that it's really, really warming. It's really potent, and the smell and the smoke is actually really clearing. So it has similar properties to sage as well. So it provides warmth to the body, it gently moves energy, it gently moves blood, and it helps to build and nourish blood as well, and provide that warmth back into that lower abdominal and that lower back area as well. So when we start, we're going to start from the top of the pubic bone, which is CV2, and we're going to go up to the belly button. So when we're doing it, we're not doing it really fast. We're going to start, and it's really slow up, take it off, and then we're going to start again. So you want to do this for 5 minutes, 5 to 10 minutes, until you'll notice a pink line along that the Ren meridian, which is why we're doing this, which is the conception vessel. And mum will start to feel warmth through that lower abdominal area. So the reason that we're doing this is we're putting warmth back into that lower abdominal area, back into the reproductive organs, back into the uterus, and this helps with healing postnatally as well. So for those women that have had a C-section, we can also moxa the C-section scar. So as soon as the dressings come off, you're going to start moxering the C-section scar, as well as doing the lower abdomen as well. So when you do the scar, choose the right-hand side. You're going to hold the moxa stick about 1 centimetre away from the skin, and then you're going to go from right to left, but it's really slow. It's not like this. It's holding it and then going really, really slow. Okay, so using moxa on the scar, again, helps to promote healing, helps to put warmth back into that area, because when we've been in surgery and being cut, our muscles and our internal organs get exposed to that cold in the air. So we want to put warmth back in to help the organs to function again. And putting warmth back in also helps to relax the muscles, but it brings in our own immune system. So it brings in the blood and the circulation and our white cells, which actually helps to clear out the area and help the body to heal as well. So I just want to put in a big caution. Moxa is really, really hot, and people do get burnt. My partner actually burnt me, but make sure that you have some pure essential lavender oil on hand. If you do get burnt, you put that straight on. It will stop that blister from forming a fluid-filled blister, and it will just help with healing. It basically goes flat within 1 to 2 minutes, and it helps really, really quickly to heal from that blister. So the moxosacral fans, so we do this to the lower back and the sacrum. So again, it's warming, it's putting that warmth back into the back. It helps to reinforce the governing meridian, which goes straight up the back. So this is our yang energy. You're going to do this for 5 to 10 minutes. So you're going to start at the crack of the lower butt, where the butt is, the butt crack. We're going to go up for 5 to 10 minutes, straight up the spine. Once you notice a pink line and mum starts feeling warm, you can then choose either the left or the right hand side to start fanning over the sacrum. So as you can see, we're literally going to start fanning. So we're going to do 3 passes, and then you're going to go up the spine again, and then you're going to start fanning out the other side. So I like to do 5 on each side, and this really helps with weakness, with lower back pain as well. So, and helps just reinforce mum's vitality. So when we're doing mother warming, we're working on the Ren meridian and on the conception, which is the conception meridian, and we're working on the governing meridian. So this is the yin energy and the yang energy. So we're reinforcing those to build mum up and to nourish her. So C-section scar repair. So we start this approximately 6 weeks after birth. So they will start with the mother warming once the dressings have come off, which is going to help the muscles to start repairing, bring blood and all of that circulation in to help with that repair. However, when we're doing C-section scar repair, we're using our acupuncture needles to actually help repair the muscles underneath and that scar. So what we do is we're going to put a needle in at one end and then the other end, and then at the top of the scar and below the scar. And when we're needling, we're actually sending the needles straight down into the muscles. So this is to bring more energy to the area, more blood to the area, and this then nourishes those muscles and enhances healing and repair as well. So doing this, we're actually reconnecting the meridians as well. So when we have that C-section, they actually cut through quite a few of the meridians. So they cut through that Ren meridian, the kidney meridian, the spleen, the stomach, and the liver. So that's actually 5 meridians out of the 12. So what we want to do is actually reconnect these meridians together. And so that's why when we're needling around the scar, we're working on the muscles. So we'll do that for the first couple of treatments, and then we'll actually start needling through the scar, which is to reconnect those meridians together, to bring energy through those meridians, blood through those meridians. So, and once we help reconnect the meridians, mum starts to feel a lot better. Many women who have C-section scars actually say that they feel numbness, they feel a bit of disconnect through there. And the reason why is that those meridians have been disconnected and cut, and we need to realign them and join them back up. So we're also aiming to bring sensation back to the scar. So I will often, on the side of the scar, I will tickle, I guess you say, the skin, and then say, does this feel like this? So C-section scar repair is individually based. So some women, it may take 4 or 5 treatments. Other women, it could take 12. It also depends if it's your first C-section or if you've actually had multiple C-sections as to how long it will take to heal. So lactation support. So Chinese medicine is amazing at helping with breastfeeding issues. We have lots of acupuncture points which are used for breast issues, not just obviously breastfeeding, but also with breast cysts and other issues, so mastitis or lumps. So we can aid with insufficiency, or we can aid with an oversupply. Most women will come and see me for insufficiency, which is a lack of breast milk. So when we're looking at a lack of breast milk production, the philosophy behind it is that they don't have enough energy and they don't have enough blood. So every time we actually breastfeed, it's the equivalent of giving blood, and blood in Chinese medicine makes the breast milk. So if they're not having enough, if they don't have enough blood in the body, they don't have enough of the requirements to actually make milk. So what we want to focus on is helping mum with her emotions, because sometimes also with the C-section, it can take 7 days for the milk to come in as well because of the physical trauma. So we want to focus on building up blood. We want to focus on building up and making sure that mum's got enough energy, and we want to increase supply. So there are actually 3 points which we use to do this. So the first one is CV17, which is in the mid chest. So what you're going to do is find the nipples, and then you're actually going to come into the chest. You're going to hold that there and rub it clockwise for 1 to 3 minutes. So what this does is actually opens up the chest, it relaxes the diaphragm, and it brings energy into that breast tissue as well. So it's a major point for producing energy in the body as well. So the other one is small intestine 1. So this is the empirical point for producing milk in the body. So as you can see, it's on the outer fingernail. So the best way to get this is get a ballpoint pen on the outside where it is, and you're going to press for 1 to 3 minutes. So this point's really tender, and it's really tender when I needle it as well. However, it does work. And then we're going to use stomach 36. Again, as I mentioned, this is great because it increases energy in the body. It builds up the immune system. It builds up blood. It builds up yin. It builds up yang. It also calms the nervous system down. So what we're going to do is we're going to give this to the woman to go home and do this 3 times a day. We're also going to make sure that she's got diet and lifestyle advice, so keeping stress down, keeping anxiety down, making sure that she's eating those warming, nourishing foods. Also making sure that she is taking time to rest. She's not running around and using up her energy. We can incorporate herbs for food as medicine. So many of you will know oats is really, really good. So it's easy on the stomach. It nourishes blood. Brewer's yeast, so it's full of the B vitamins, which is going to help with energy. Goat through, which is the galactagogue, again, working on building up milk production. Fennel, which is really good for digestion as well as supporting breast milk production. So here in Australia, I also recommend to my mums that they take a breastfeeding supplement. I use Herbs of Gold because that's actually got 6 grams of fennel in it, plus 3 grams of milk thistle. So, and we get them, if they've got low milk supply, we get them to take 2 in the morning and 2 at lunchtime. Also providing them with blood building gravies. So this is going to help to nourish that blood and also collagen, and build up and nourish blood and bone broth soup. So in traditional Chinese medicine, we do have formulas which we use to help increase milk supply as well. And we use 3 main herbs, which are Tong Sao, Wanbu Lucin, and Lulu. So I will often give them a formula depending on what's going on, especially if they're stressed. I'll give them a formula to help decrease stress, promote the fluid flow of energy and blood, and add these 3 herbs in, plus get them to be eating the oats, taking the brewer's yeast, the goat through, and that breastfeeding support. So mastitis. So Chinese medicine can actually really help with mastitis, and many people don't think about this. So mastitis is actually caused with blocked ducts. It's actually a bacterial infection caused by Staphylococcus aureus, and it can be caused by stress. So mum's getting really stressed out, which affects the flow of energy through that breast tissue. It can be caused by babies biting mum, especially when they're teething and teeth are coming through, or it can be caused by the insufficient clearing of ducts. So this may be that baby is not latching correctly. Baby may have lip and tongue ties, so therefore not latching and therefore not clearing out the ducts when they're feeding. So some women can have no mastitis, some other women can have 13, 14 bouts. My sister used to have mastitis every 3 weeks. So where I start first is with emotions. Are they stressed? Are they anxious? What's going on? Are they getting enough sleep? How is baby feeding? How often is baby feeding? And I refer them to a lactation consultant as well, because I want them to make sure that baby's feeding, latching, and clearing those ducts correctly. So we actually use a combination of moxa, acupuncture, massage, and herbs to help with mastitis. So one way that we do is firstly, you want to put heat to the breast. So that heat will encourage the body's natural healing process, bring all of the white cells in and help clearing up heat. So many women with mastitis will start feeling a bit headachy, a bit cold, like they're coming down with the flu. They may develop a fever. You'll also notice that the breast might be a bit hard. There might be some red area through there. I always, when mums start feeling like they're getting a cold, I always get them to check their breasts and make sure that they're nice and soft. There's no hard patches at all. And just in case, hop in the shower with the heat and give their breast tissue a massage and express in the shower as well. So one way that we can help to treat mastitis is massaging the breast. So we're going to massage from under here, starting where the ducts are, and then around the breast tissue, and then around the areola. I incorporate lavender with the massage oil because lavender is actually antifungal, antibacterial, and it's calming, and it will penetrate down in and help with the infection. What we can then do is get a really small cup, and we're actually going to place a cup over that nipple, leave it there for about a minute, and when you take it off, you'll notice that milk starts pouring out, and you'll generally have like a clunk or a big chunk where the milk duct was actually blocked. So yeah, we're going to apply heat. We're going to get mum to make sure that she's massaging the breasts, that she's feeding baby at least every 2 hours, and in between that she may need to hand express or to pump as well, because we want to make sure that those ducts are really being cleared out, that all of the milk is actually being cleared out of the breast tissue as well, because the blockage can actually affect milk production. So we're going to look at emotions. So stress is one of the major underlying causes of mastitis from a Chinese medicine point of view, making sure that she's not stressed or helping to calm her stress. So this is where we use liver 3, which is that point in between the big toe and the second toe. This is really good. It clears heat, it clears blocked energy, and also helps to release emotions as well. So the other way that we help with mastitis is actually surrounding the breast tissue with needles. So we're going to use that CV17 point. We're going to use needles above the breast. We've also got a point that's just in our arm, and then stomach 18, which is directly under the nipple and under the breast. And we're going to form the needles in around the breast, pointing in towards the nipple. So this brings energy into the breast, into the milk ducts as well, and helps to clear any blockages in energy and with the flow at the same time. So providing emotional support. So this is one of the major influences in helping with a woman postnatally to recover. So as you know, with being a mum, there's so many emotions that go on. Am I doing this right? Fatigue, overwhelm, there can be anxiety, depending on how the birth has gone as well. There could be some trauma going on. So we want to make sure that we're providing a really nice, calming and supportive environment for her. We want to make sure that mum is taking some time out and time to provide herself with self-care. So when I'm talking about self-care here, I'm not necessarily talking about going out and getting a massage. I'm talking about making sure that she's eating, making sure that she's drinking, making sure that she is getting rest, that she's sitting down for at least, 10 minutes, or just taking some time out, or going outside for 10 minutes and just doing some gentle exercise. Also, that we're promoting oxytocin as well to help with balancing emotions. And the oxytocin also helps with breastfeeding and the letdown process. So this is called Buddha's triangle. So it's actually, if you have a look at my inner wrist, you'll notice that there's a line that goes across here. So lung 9 is just underneath the thumb. Heart 7 is just underneath the little finger. And then if you get 3 fingers, you're going to put that on the line, and where that falls is pericardium 6. So these points are used to help balance emotions. They're calming, they calm the mind, so they help to prevent overthinking, over worrying. They calm the nervous system down. PC6 actually works on digestion, reinforcing digestion and making sure that digestion is flowing so that we're getting enough nutrients and enough energy from our food. And lung 9 helps to open up the chest, and if there is any grief, it moves stuck energy in that chest as well. So I teach mum how to do this. So again, you can do this on yourself, or you can get your husband or postnatal doula or the mother-in-law to do this. And it really helps to calm that system down. So I'll give mum breathing techniques as well to calm the nervous system down. So breathing in for a count of 6 through the nose, out for a count of 8 through the mouth. So doing that vagal breathing, so turning off the fight and flight response and turning on that rest and digest part of the nervous system, which is really, really important. I'll get mums to soak their feet in Epsom salts. So this is nurturing as well, helps to relax stiff muscles, especially if they're breastfeeding and getting neck and shoulder pain. Get their partner to massage through the neck and shoulders, or mum or mother-in-law to do a foot massage or a hand massage. So this is all forms of helping with emotional support and letting mum make sure that she's getting some self-care as well. So fatigue support. So as we said, we're going to use stomach 36 with fatigue support. We're going to make sure, again, that we're reinforcing that diet and lifestyle issues, that mum is getting enough rest, that she's eating, that she's making sure she's getting enough water, enough fluids in, making sure she's taking time out, and making sure that she's actually has some support. And we do find that mums, obviously with the sleep deprivation and everything, tend to not look after themselves so much. So we really need to focus on bringing to the forefront that they are eating, they are drinking, they are taking time out, or they're asking for help. So we want to focus on diet, again, that congees, the bone broth soups, and gentle exercise. So again, some yoga, some qigong, just walking. Focusing on balancing emotions and calming them down. So making sure that there's no stress, there's no emotional upheaval, that we're helping them if there's any anxiety or underlying worrying going on. So we're going to get them to press stomach 36 daily. We also will incorporate herbal formulas, so to help with energy and building up vitality, nourishing blood, and just calming that nervous system down. Easy to digest food. And we're going to do CV12. So how we find this point is we come from the sternum to the belly button and halfway in. So this is actually the empirical point for digestion. So it reinforces the energy of the spleen and stomach. It's used for all digestive issues. So constipation, reflux, low appetite, pain through that digestive area. And I also provide a handout to reinforce energy in the body, which they can do daily, which is using that CV17 point, stomach 36, and then large intestine 11 is just at the end here. So this is actually a point which is a HERC point, so it dives deep into the body to help bring out energy and produce energy in the body. So many new mums will be living on caffeine. Caffeine actually helps to drain the adrenal system and deplete you even more. So I do talk to mums about alternatives. So I'll provide them with an energy tea, which has huang qi or astragalus in it, which helps to promote the body's own building up energy, reinforcing the immune system. If mum is feeling really tired, one thing that I will get them to do is a facial scrub with caffeine first thing in the morning, and that actually gives them some vitality, some energy, and we'll use peppermint oil with it as well, which goes straight to the head, which helps with memory and with concentration. So other ways to reinforce that energy is doing yoga, just to squeeze through the spleen and stomach organs, a bit of Tai Chi, so through the spleen and the stomach meridian as well, through that Ren meridian and that Du meridian. So you don't want to be overdoing it, just some gentle exercise and focusing more on like 5 to 10 minutes of exercise, because that will get all of the energy, the blood flow going as well, and helps to increase energy, therefore fighting that fatigue. So in conclusion, the Golden Month is an ancient Chinese medicine tradition, but it's also found through India, Malaysia, the Native Americans as well. It generally is 30 to 40 days in length. The focus is on recovery. So we want mum to be replenishing her energy and her vitality. The focus is on mum. So bonding with baby, getting plenty of rest, establishing lactation, and that's it. That's her main job for those 30 to 40 days. We want to make sure that there's no stress, no anxiety, and just reinforcing energy and helping her to replenish herself. We want to provide support. So mother-in-law moves in, having a postnatal doula, for multiple births, postnatal doula, a nanny, and providing nourishing food. So the overall conclusion is that providing care and nourishment and nurturing mum during this time helps to assist to strengthen her health and prevent future problems with physical, emotional, and mental well-being further down the track. So I hope you've enjoyed this presentation, and I look forward to answering your questions.
Oh, wow, Julia, you are just such a great presenter. I love listening to you. I'm sure everybody does. So much great information. We've got a question there about fruit and how the comments with regards to no raw food and how does that affect fruit. I imagine that the answer is simply that we should be cooking our fruit. Is that the answer?
So with fruit, obviously here in Australia, like when it's really hot, so apples and everything should be cooked, but if it's really hot, you want to be giving them cooling foods such as watermelon, which is really high in water content. So we do say have fruit, but it would be better to have it cooked. So you're going to cook apricots, peaches, etc., and do stewed fruits because they're much easier on the digestion. So pears are really good, your apricots, your nectarines, stewed apples are really good as well. And you can actually add them into your congees. So in the handout, I've got a recipe for some sweet congees and what you can add in. So yeah.
Fantastic. And what's another question that's come through that we haven't answered yet is how long after birth are you saying that it's okay for mum to be starting yoga?
So she can, look, when we're talking about yoga, I guess you'd start off with gentle stretching for the first couple of weeks, especially if you've had a C-section. You don't necessarily want to be going full on into it. So just gentle stretching. So literally just standing up and doing a twist, you know, some arm movements, laying down and just trying to touch your toes is what we're sort of saying yoga. So you don't want them going full on into a yoga session. It's more just stretching out the body and just getting that body and energy circulating. So, and again, just gentle walking, like even 5 times up and down a hall, and that's it. So yeah,
but exactly, so it's just about, it's not so much yoga because there's so many different kinds of yoga. It's really sort of saying that it should be just, you know, absolutely gentle. So saying to a woman that it's fine to be doing some yoga, you know, a few days after having a baby. We're not talking about, you know, Bikram yoga in the heated room.
We're not talking about hatha yoga or Ashtanga or anything like that. It's more just gentle stretching.
Yes, gentle.
So,
gentle. Look, it's just wonderful, and we're running out of time. And oh gosh, have I lost you there?
No, I'm here.
No, you haven't. Oh, okay, sorry. I thought I lost you all there for a second. Look, Julie, you're just fantastic. Thank you so much for your time, and those of you that are here live today, you know, thanks for taking the time to be here, and I know a lot of you'll be watching it afterwards as well. And so for those that have registered for this webinar, of course you shall get an automated message tomorrow with details about how you can get hold of a copy of this PowerPoint. And like, just there's so much I'm kind of dying to throw in there, because I haven't been in the field of doing postnatal visits, you know, for a long time, and but you've just nailed it. There's it's the wellness that those mothers have, those Chinese mothers with those Chinese grandmothers looking after them, the wellness that they have is just sometimes absolutely light, and, you know, lighter, black and white in comparison, day and night in comparison to what a lot of our European women go through. And it would be good for us to take on a lot of that wisdom, that's for sure. But anyway, look, thank you everybody for being here, and we'll see you next week. Okay. Thank you. So, Julia, is there anything else you want to close with?
No, just thank you so much for listening to my presentation, and I think I might follow it up with another one in June. So, because there's so much, obviously, postnatally that we can do. So, yeah.
That'll be wonderful. Thank you so much, everybody. Have a good week. Bye.
Bye.